Hello, and welcome back to episode 8 of the COVID Longhaulers Podcast. We're a community of COVID longhaulers who have been brought together by this illness and wanted to create this resource for other long haulers. We share the stories of folks who have been through it, who are going through it, and how they're surviving it. My name is Emerson, and I'm co-hosting today with Rush.
Hello, everyone. So, in most episodes, we talk about the visible effects of COVID, the lingering symptoms, the struggles of living with long COVID that we long haulers experience. But today, we are turning our attention to something just as important, but far less obvious: the invisible damage that COVID infections can cause, even in people who don't develop long COVID. So, each COVID-19 infection, even the mild ones, causes silent, cumulative damage to the body, increasing the risk of long-term health problems across multiple organ systems. And a good way to picture this is like a river that rises every time you catch COVID. Each subsequent infection causes that river's waterline to rise, and eventually, with enough infections, it will burst its banks, and then you will have long COVID.
Right. And the idea for this episode actually came from a recent article from the CBC radio called Beyond Long COVID: How Reinfections Could Be Causing Silent Long-Term Organ Damage. You can find a link to that article in our show notes. This article is actually an interview with long COVID researcher David Petrino. And in it, he spoke about the emerging research showing that, COVID doesn't just disappear once you recover from the acute infection, and that it instead leaves lasting impacts on your brain, immune system, heart, and pretty much every organ system in your body. This article is really interesting to read, but there was one quote that really stood out to me, and that was, "There is no such thing as a COVID infection without consequence." And that is exactly what Rush and I are here to talk about today.
And before we get started, the usual caveat in our podcast applies more than ever to this particular episode, since we will be delving into the science. So, while the information presented in this podcast has been thoroughly researched and taken from reputable sources, which we will link in our Substack, which you'll find in the show notes, we are not medical professionals, and nothing in this podcast should be taken as medical advice. Always consult your doctor. I also want to clarify a few definitions first. So, the World Health Organization defines long COVID as symptoms that persist 3 months after the initial infection, or that develop after that point with no alternative explanation. And also, throughout this podcast, we might use the term SARS-CoV-2 and COVID-19 interchangeably, but they are two different things. SARS-CoV-2 is literally the name of the virus, and COVID-19 is the name of the disease that it causes. I'm very guilty of muddling these two terms together as if they both mean the same thing, and I'll definitely do it a bunch today. So if you're a virologist or a medical professional listening to this, I just want to save you a bunch of eye rolling right now and get that disclaimer in here early.
I actually did not know that, Rush, so thank you for teaching me something new. I also wanted to say up front that the mechanisms we're going to talk about today are pretty complex. We have done our best to break them down into something clear and understandable while still keeping the science accurate. But if any of this feels overwhelming or confusing, don't worry. We've also created a glossary to help explain the medical terms that we mentioned here. And there's also a written version of this episode and a transcript available. You can find the link to all of that in the episode description. Okay, so now that we've gotten through all of our disclaimers, I think we can finally get started. I think it makes the most sense if we begin with how the virus enters the body in the first place. So, do you want to tell us a little bit about that, Rush?
Yeah, so the virus usually enters through your nose or mouth when you breathe in air that contains viral particles. Once it gets into your nose, it targets specific cells that have these little receptors on them called ACE2. That's the main entry point for SARS-CoV-2. The virus latches onto these receptors using a spike protein.
Yeah, and ACE2 is found all over the body, but it's especially common in places like your nose, lungs, gut, and other places like your heart and even the brain. And that's part of the reason why COVID can cause symptoms in so many different organs and systems, because it can get into all of those places by using ACE2 as a doorway.
After the virus sticks to ACE2, it gets a little help from enzymes to break into the cell. Then once it's inside, it starts taking over the cell's machinery to make copies of itself. And that's how it spreads and starts causing damage in your body, short-term and long-term. This creates like a ripple effect as the virus multiplies and spreads through different parts of the body. And in this process, it can trigger inflammation. It can confuse or exhaust the immune system, and it also damages the tissues where it spreads. And over time, this leads to long-lasting damage.
Yeah. So, Rush, how does COVID actually damage our bodies?
Well, I'm glad you asked, Emerson. There were quite a few different suspected mechanisms, and one of the big ones is viral persistence, which you might have heard about in the media. SARS-CoV-2 it can linger in what are called immune privileged areas, like the brain or the eyes or the testes, and in pregnant women the placenta. And these are parts of the body where immune responses are more tightly regulated to prevent damage. And it's not that these areas don't have an immune system protecting them, rather they have specifically adapted immune environments, and they rely on things like physical barriers, like you might have heard of the blood-brain barrier, for instance,
Yeah.
as well as some other local immune tolerance mechanisms. But it also means that they can become hideouts for a virus if it can successfully bypass these measures, which SARS-CoV-2 appears to be able to do.
Well, so what are these immune privileged sites and why do they exist?
Well, they exist because your immune system it's really good at fighting infections, but it's also kind of a bull in a china shop. And if it went all out in these sensitive areas, it could cause massive inflammation and then cause permanent damage as a result. So if you take the eyes, for example, they're immune privileged because excessive inflammation could cloud the cornea or damage the retina, leading to vision loss or even blindness. If the eyes weren't immune privileged, your own immune system could start attacking eye tissues after a minor injury or infection. So basically, your sight would be wrecked by your own defenses.
Oh.
So that's why we have these immune privileged sites. But unfortunately, the virus is potentially using those against us by hiding out in there. So that persistence can lead to ongoing inflammation and damage long after the initial infection has passed.
Wow. I did not know any of this. I'm really learning a lot today.
Yep. Well, this is science hour on the podcast. So
Yeah.
like another leading theory is chronic inflammation. If you think of it like a smoldering fire that never quite goes out, it can lead to complications based on a person's vulnerabilities, like pushing a pre-diabetic into full diabetes or triggering autoimmune flare-ups. And unlike acute inflammation that helps your body heal and then turns off, chronic inflammation does not switch off, so it can damage the body's tissues. And this affects just about every part of the body and is a precursor to chronic diseases like type 2 diabetes or cardiovascular diseases. And in fact, more than 50% of all deaths worldwide are attributed to chronic inflammatory diseases, including cancer, cardiovascular disease, dementia, stroke, and diabetes.
Wow, that's a very, very high death rate. And then there are also the unique qualities of the virus itself. For example, the spike protein alone can cause vascular damage. Acutely, COVID is considered to be primarily a respiratory disease, but it's actually a vascular disease that can cause damage to multiple systems. For example, COVID causes endothelial damage. The endothelium is a very thin layer of cells that lines the inside of blood vessels and plays a key role in regulating things like blood flow and inflammation, as well as immune responses. You can think of it like a wallpaper that coats the inside of all your blood vessels. It's in your heart, your lungs, your kidneys, brain, and even your gut. But when this wallpaper gets damaged, it can peel, fray, or even become inflamed. And that then disrupts the function of whatever room or organ it's part of. So when COVID damages the endothelium, it's like compromising the protective lining of an entire plumbing system, and that can trigger widespread dysfunction in the organs it supports. Aside from this, as if that wasn't enough, COVID also triggers a very strong immune response, which can cause several immune-mediated health conditions such as dysautonomia or ME/CFS, which we commonly see in COVID long haulers. And I think that's an important thing to be aware of because a lot of the problems long haulers suffer from can be traced back to circulatory issues as opposed to respiratory issues.
Yeah, the virus can also disrupt red blood cells and platelets and mess with what's called interferon signaling, which is a crucial part of your immune system's early warning system. It helps coordinate a rapid response when the viruses show up, alerting nearby cells, activating other parts of the immune system to fight off the infection. If that system is disrupted, your body loses time and efficiency in mounting a defense, which allows the virus to spread more easily and stay hidden longer. This weakens your immune system defenses and even reactivates latent infections like Epstein-Barr. And nearly 95% of adults worldwide have been infected with this Epstein-Barr virus. So it makes it the most common human herpes virus. It also
Whoa.
causes mono. Yeah, it's known as the kissing disease.
Yeah.
But most people actually catch it sometime during childhood with either no symptoms or mild symptoms. So it's not just a disease you get by kissing. You can get it loads of other ways.
Yeah.
But once you've got EBV, that virus remains in your body for the rest of your life. EBV, by the way, is also known to cause persistent fatigue, such as ME/CFS.
Yeah, and as we already mentioned, these mechanisms are obviously far more complex than what we described here, and there are some other leading theories as to how COVID enters and then causes damage in pretty much all of our organ systems. But that would have been way too much to cover in this short podcast episode.
Right. So, like, now that we've laid out some of the core mechanisms here, let's talk about what that actually looks like in the body, because this isn't just theoretical. We're seeing measurable and in some cases shocking impacts across multiple organ systems. And this is not just in people with severe cases, but those who thought they had a mild infection that bounced back completely. So people are not aware of this damage in their bodies.
Yeah, that's honestly pretty scary to think about. Let's start by looking at the neurological damage, specifically how COVID attacks the brain and the nervous system. This was really shocking to me. Each infection is associated with an average IQ drop of 2 to 6 IQ points, even in people who don't develop long COVID. This decline affects things like memory, reasoning, and executive function. It was obviously the worst in those with long COVID, but you do not have to have long COVID to experience this kind of decline.
Yeah, this study, which was it was published by the New England Journal of Medicine, is really interesting. What they did was they compared the cognitive capability of thousands of people who had mild COVID-19 against the cognitive capability of the public from a point in time.
Mhm.
So this means it wasn't designed to measure the specific changes in an individual's cognitive abilities due to COVID-19 directly. Instead, it compared the cognitive function of individuals who had been infected to uninfected controls at a single point in time.
Yeah.
So the findings showed a 3 point IQ drop in those with mild COVID, with even larger deficits in people with unresolved symptoms or ICU stays. And while it doesn't prove direct cause and effect for individuals, the trend is pretty clear that even mild infections are linked to measurable cognitive decline.
Yeah, this is honestly something that I can personally relate to because I've had COVID 6 times now, and it was only the fourth infection that completely disabled me, where I developed all the debilitating long COVID symptoms. But looking back, with all of this new knowledge, I now see how I started to slowly deteriorate cognitively. Like after my second and third infections, which were really close after each other, I suddenly had issues with executive function. And I also really struggled to focus on things for a longer period of time, which were things that I used to never have issues with in the past. It wasn't really major enough for me to raise any red flags or to go to a doctor and be concerned about it or even connect it to COVID. But it is pretty interesting to think about.
Yeah, well, the good news for both of us, Emerson, is that we're not really talking about literal IQ loss.
Yeah.
No, what we're saying is like it's a measurable cognitive impact equivalent to a drop in IQ of up to 10 points. Thereabouts. It's not literally making people stupid. It's just mentally impairing them while they deal with long COVID. And I guess in the moment though, when you're dealing with these issues like brain fog, executive function, that sort of distinction probably isn't going to mean much to you.
Yeah, you're right.
Also, animal studies have shown that even mild COVID infections can cause the body to release certain chemicals called chemokines that inflame the brain and the spinal cord. And in more severe cases, this inflammation has been found in the brainstem, the area that controls critical functions like breathing and heart rate.
Yeah, so this could explain symptoms like brain fog, memory loss, and even the increased risk for Alzheimer's and Parkinson's post-COVID infection. One study from the University of Birmingham also found that the cognitive impairments are comparable to 20 years of normal aging. So it's clear that the virus leaves its mark on the brain, whether through reduced brain volume, inflammation, or neurodegeneration. And children who are exposed to COVID while still in the womb are 10 times more likely to develop developmental disorders when compared to other children where the parent was not infected with COVID whilst pregnant.
That's crazy.
Yeah. And I'm pretty sure very few doctors inform parents of like, hey, be careful. And just this week, a new study came out showing structural changes in the brain after COVID infections. It supports what is called the broken brain syndrome. This means that disconnections between the brainstem and the cerebellum may be causing many of the symptoms we see in post-COVID syndrome, so long COVID. And these are things like motor issues, balance problems, and autonomic instability. They even found volume loss in areas responsible for regulating sleep and pain, which honestly lines up with my own long COVID symptoms and those of many other long haulers. Reading all of this in preparation for this episode was pretty frightening, and it was really scary to realize just how deeply COVID can affect the brain and how much of this can happen without us really realizing because there aren't any immediate signs.
Yeah, absolutely. And besides the brain, COVID also seems to weaken and disrupt the immune system. So, for example, COVID disrupts T cell function, leading to immune exhaustion. And T cells, they play a vital role in identifying and eliminating virus infected cells. So when they become dysfunctional, your immune defenses are weakened. This immune exhaustion leaves the body less capable of responding to new infections and also less able to suppress viruses that already live in the body. So that's why people recovering from COVID face a higher risk of, we were talking earlier about the Epstein-Barr virus
Hmm.
reactivation and other dormant viruses as well, like herpes, they start flaring up again. Essentially, COVID can push your immune system into a prolonged, drained state. It's like a kind of chronic immune burnout.
It's kind of like our immune system is in a constant low grade battle. It gets worn out, and when that happens, you become more susceptible to bacterial infections, pneumonia, and even new viral infections. In other words, your body becomes less effective at defending against common threats, and this leaves the door open for complications that can turn otherwise mild illnesses into serious health problems, especially over time.
Yeah, there's actually an outdated idea that the immune system needs to be tested to stay strong. Have you heard of this?
Yeah, I have. It's so wild to me.
Yeah, so science used to suggest that it was like a muscle that needed to be exercised, but that's not the modern understanding. It's more like a library. It stores knowledge on each infection, and for a time, it has that book in its hand and a response primed and ready to combat that infection. And this is why vaccines can have a window where they're effective, like we've seen with the COVID vaccine, where it can give you protection for up to 6 months. But after a while, that book eventually gets put back on the shelf when the virus doesn't show its face for some time, which means the next time it arrives, your immune system, it can still respond quickly, but it needs to go and fetch that book again first. It doesn't have a response primed, but it also doesn't need to write the book again to deal with it either. So today, the modern understanding is we know that each infection weakens the immune system, and avoiding infections is critical because the body accumulates damage with each fight that it gets into.
It's so interesting because so many doctors and healthcare professionals, they still tell you that, you're going to become sick by protecting yourself from infections and viral infections because this misconception, this outdated idea is still perpetuated within society and so many authoritative figures. But before we move on to the next section, I would like to add this because I think it fits into the discussion of the immune system. And it is that researchers have seen quite an increase of autoimmune conditions since the pandemic. A large study published in early 2023 found that people who had documented COVID infections were significantly more likely to develop autoimmune diseases compared to those who had never had COVID. The list of autoimmune conditions included quite a few serious conditions like rheumatoid arthritis, lupus, vasculitis, type 1 diabetes, and inflammatory bowel disease, as well as many other conditions. I'm honestly quite surprised that they were even able to find a control group for this study that had never contracted COVID before.
Yeah, I think in order to find those people that haven't had COVID by now, you're looking at what, those tribes that have never been contacted.
Yeah. Like in 2023, it's more likely that there were people who had never been infected, but now in 2025,
They are a rare breed,
yeah.
that's for certain. I think there's another important factor here called it's something called a cytokine storm, and that's when the immune system overreacts and floods the body with these inflammatory signals, which can lead to damage in multiple organs, including the heart. And according to Cleveland Clinic, these cytokine storms can directly damage the heart muscle and the tissue lining blood vessels. And that damage can persist long after the infection itself is cleared.
Right. And that leads us to the cardiovascular system, which also takes a hit by COVID infections. Research shows that even mild COVID cases show long-term effects on vascular health. The virus causes inflammation in blood vessel linings, which increases clotting risks. This inflammation can lead to the formation of microclots, so tiny clots that may not exactly cause immediate symptoms but can reduce oxygen delivery and strain the heart over time. Just to clarify here, these microclots are not the kinds of clots that typically cause heart attacks or strokes. They are much smaller and not dangerous in that regard, but they are suspected to cause quite a few symptoms like brain fog.
They've also shown in studies that the virus can infect coronary arteries directly and remain there, embedded in what are called arterial plaques. These infected plaques can then become unstable and more likely to rupture, which can then seriously raise the risk of dangerous heart problems. And there's a worrying trend emerging in younger adults. A study from Cedars Sinai Medical Center found that people ages 25 to 44 saw a nearly 30% increase in heart
Wow.
attack deaths over the first 2 years of the pandemic.
Wow.
Yeah, researchers think it might be due to a combination of effects, like COVID seems to make blood stickier, so it's more likely to clot, and it stirs up inflammation in blood vessels, and it can trigger stress responses that spike blood pressure, all of which raise the risk of heart attacks, even in people without pre-existing heart conditions.
Wow. Yeah, the gut too takes a hit by COVID. COVID can stick around in the gut for months, where it keeps causing inflammation and triggering the immune system. It also messes with the gut microbiome. When the microbiome balance gets thrown off, it can lead to stomach problems, chronic inflammation, and a weaker immune response, especially since a large part of our immune system is actually based in the gut. Some researchers think this may be one of the reasons why long COVID persists, because the virus can use the gut as a hiding place because it is immune privileged. And these issues in the gut can spill over and affect things like energy, mood, and how well your body can fight off future infections. In addition to the changing balance of good and bad bacteria in the gut, COVID can damage the gut lining. In more severe cases, this damage allows bacteria to leak into the bloodstream and cause secondary infections. This is something that was mainly observed in hospitalized patients, but even in milder cases, researchers are seeing signs of gut permeability issues in long haulers. So, while it might not always lead to obvious bloodstream infections, that compromised barrier can still create widespread immune and metabolic problems and might be contributing to a condition that is called leaky gut syndrome.
Right, and that gut lining is supposed to act like a protective wall. And when that wall breaks down even partially, it's like leaving the gate open for trouble, you know?
Yeah.
Bacteria or toxins that should stay in the gut, they start leaking into places where they don't belong, and the immune system has to work overtime to deal with it. And it can create a constant low grade inflammation that affects not only digestion, but energy, brain fog, and your overall immune system resilience.
Gosh. There are also quite a few signs of damage in the reproductive system.
Yeah, we're getting the whole tour of the body here. So
Yeah.
on the men's health side of things, it said in these studies, it said 1 in 5 men surveyed had erectile dysfunction 2 years after COVID. Researchers also documented inflammation of the testes and other organs, reduced sperm motility, and DNA fragmentation in semen as well. So these effects suggest lasting changes to reproductive health. Inflammation in the reproductive tract can reduce hormone production, and damage to sperm can contribute to infertility. And some researchers have also found traces of the virus in testicular tissue, which could explain the persistence of these symptoms well after the initial infection.
And people assigned female at birth are also affected by COVID. COVID has been linked to the menstrual cycle disruptions, ovarian, as well as fertility issues. And many people have reported changes like longer or shorter cycles, more intense periods, or even skipped cycles altogether. Researchers believe that this could be due to COVID's impact on hormone signaling and inflammation in the reproductive system. Just a little not so fun fact that I would like to add at this point is that periods themselves can cause quite a bit of inflammation, especially in individuals with endometriosis, adenomyosis, pelvic inflammatory disease, or PMS. So I guess it makes sense that COVID would be messing with that as well. This has not been studied, but a lot of people with endometriosis have reported that their endometriosis symptoms worsened after COVID infections. So I'm hoping that when endometriosis is finally taken seriously by medical professionals, we will see more studies and information on how COVID interacts with reproductive conditions like endometriosis, adenomyosis, or pelvic inflammatory disease. There are also a lot of concerns about complications during pregnancies. That includes things like a higher risk of preeclampsia, placental insufficiency, and poor fetal growth. And COVID also doubles the risk of preterm birth. And around 25 to 76% of pregnant individuals with COVID-19 develop long COVID. I wonder if doctors are telling their patients, their pregnant patients, that they are at a higher risk of developing long COVID and should hence probably be taking more precautions.
And not to mention the thing you brought up earlier about
Yeah,
babies having developmental disorders, 10 times more likely, I think you said.
yeah, exactly. It's becoming pretty clear that, reproductive health is another area where COVID leaves a significant mark, and it's something that, more people should be talking about.
Yeah, completely. And there's one, just to finalize our tour of the body here, there's one last aspect of damage we want to discuss, and that is the increased risk of cancer.
Yeah, what do we know about that so far, Rush?
Well, we know research in this area is only just emerging, so the answer is not much yet. But there are reports of patients developing multiple cancers at once, as well as an observed rise in rare aggressive cancers since the pandemic. And COVID may accelerate cancers such as lung, colorectal, pancreatic, and oral cancers by disrupting the immune system function and tumor suppression. And this could be due in part to the virus interfering with protective systems in the body. Like there's a protein called P53, which normally suppresses tumors and helps repair damaged DNA. And if that system gets disrupted, then abnormal cells might be able to grow unchecked. And at the same time, immune exhaustion caused by COVID means the immune system is less able to detect and destroy early cancer cells. Chronic inflammation, another side effect of COVID, also known to promote tumor development. So together, these effects could potentially increase both the risk and the speed at which cancers grow.
Wow.
It's quite
Um,
alarming, really, isn't it?
yeah, it's really terrifying to think about. Studies in mice also suggest that SARS-CoV-2 can awaken dormant cancer cells, leading to a sudden and aggressive tumor growth. This is especially concerning because these cancer cells may have been sitting there quietly for years, not causing any issues at all, only to be activated by the virus.
Yeah, and to give a bit more context here, the connection between viruses and cancer is not new. Like scientists have understood this connection since the 1960s. It's well established that certain viruses like HPV, like Epstein-Barr, hepatitis B, they can all directly trigger cancer. In fact, around like 15 to 20% of cancers worldwide, that's more than 1 in 6, are caused by infections. These viruses, they stick around in the body and they cause long-term changes that can lead to cancer. And now we know SARS-CoV-2 can also persist in the body for months, sometimes longer, which raises red flags about whether or not it might have similar effects as well. Um, that said, it is important to be clear here. As of now, there is no definitive real-world data linking SARS-CoV-2 to cancer. The early signals are troubling and definitely pointing in that direction, but we still need more research and ultimately more time to understand the long-term risks.
Absolutely. But even so, SARS-CoV-2 and the subsequent COVID infections do far more in your bodies and cause much more damage than what we could easily explain here. Besides all this invisible damage, there is a lot more visible damage, like hearing loss or visual issues such as retinal damage, and all the well-known and documented long COVID symptoms like fatigue, heat intolerance, brain fog, heart palpitations, and so on. So this is not an extensive list, it's just a glimpse of what is going on. But I do think that all of this is enough to teach us a very important lesson. COVID is not a safe virus to catch, and it is really important to avoid infections as much as possible. Because even if you do feel fine after a COVID infection, you very likely have some lasting damage that you are not aware of. And you might just be one COVID infection away from developing the debilitating long COVID symptoms that we long haulers have, since the damage is so cumulative.
Okay, so thinking of the measures people can take to avoid COVID infections, what's what sort of the best measures they can do here?
So for me personally, I think the best measure is to wear a high quality respirator like FFP2, FFP3, or KN95, N95, since these are designed to fit tightly around your face and filter out at least 95% of airborne particles, and that includes viruses as well. That makes them far more effective than surgical or cloth masks, especially in an indoor place or in crowded spaces. However, any respirator you wear should ideally be fit tested for your face to ensure that it doesn't break seal when you are turning your head or talking. There are many DIY fit test kits that you can research online, and we'll add some info about it in the show notes. I personally wear a respirator whenever I leave the house, even when I'm outside, if I know that I'll be sharing air with people who do not take COVID precautions, because the risk, outside is far lower than it is indoor, but it is never zero. And my immune system has been weakened by my six COVID infections, and I do not want to get a seventh COVID infection. Besides respirators, things like CO2 monitors can help you figure out if a space has poor ventilation. Because if CO2 levels are really high, the risk of airborne transmission is higher too, since the aerosols remain in the air for a longer period of time. Air purifiers with HEPA filters can also reduce the viral load in indoor environments, especially if you're in a shared space where you're not allowed to wear a mask or a respirator.
Yeah, and keeping up to date with your vaccines, COVID and otherwise, can also help minimize the damage that we're talking about here. Like they might not stop every infection, but they will significantly reduce the risk of severe illness and some of the longer term effects like brain fog or heart problems. And keeping up with the boosters gives your immune system a better shot at handling exposure if it happens. And of course, the more people vaccinated against COVID and other viruses, the less opportunity these pathogens have to spread throughout the population, making everybody safer.
Yeah, exactly. All right, I think this wraps up today's episode. Thank you so much for joining us today. We hope you enjoyed this more science focused episode and maybe learned a thing or two about COVID. I know that I definitely learned a lot. As a reminder, while our discussions offer medical related insights, this is not medical advice. Always consult your healthcare team with any of your medical concerns. And for our listeners interested in joining our Discord community, you can find the link in the description to connect with us. We aim to release new episodes monthly, and every episode is different, so please subscribe and stay tuned. Until the next time, this is the COVID Longhaulers Podcast signing off. See you on the next one.
See ya.